name is Kaylee Monk. I am videotaping today for my head to toe assessment for nursing 545 through Southern New Hampshire University. This is my pretend patient, KM. She has already signed a consent form for me to be able to record her, but just to verify, are you okay with me recording you today?
Yes.
Great, thank you. So we'll go ahead and get started. So what are your initials and your date of birth, please?
KM 6292.
Great, thank you. All right, so first I'm going to wash my hands. So I'm going to do a full head to toe assessment on you today. I'm going to start by just kind of taking a look at your skin, and then we'll move from the head down, okay? All right, so first and foremost, I'm going to check your arms and your skin for any kind of discolorations or swelling, any kind of lesions, scarring, any abnormal moles, which I don't see anything of here. Your skin color looks good for your ethnicity, so you don't leave relax those arms. And I'm going to check your legs for the same thing. I see no swelling, no abnormalities, nothing of concern. Feet look okay as well, no swelling, so that's good. All right, so moving on, I'm going to just kind of check your hair, looking for any kind of uneven distribution, any lesions, any abnormal texture, which your hair looks good. Okay, great. So I'm going to start with your head, okay? I'm just going to kind of feel your face real quick. Just feeling your temporal arteries. Good. Any pressure when I press here? No. Good. Coming back around, I'm going to have you open your mouth for me. Good. And then one more time. Good. Coming down, just feeling it for any kind of swollen lymph nodes, which I don't feel any. Maybe stick your arms out straight for me so I can check your axilla, lymph nodes. Good. No swelling. I'm going to come around here and just check your thyroid. Good. So I'm going to take a quick listen to your side of your head real quick for your temporal arteries. Good. Great. Okay. Looks good. So moving on, I'm going to check your eyes, okay? So you're going to have a bright light in your eyes. I'm going to check for any kind of pupillary response. So go ahead and just look straight forward. Great. Excellent. Okay, so now I'm going to use my ophthalmoscope and I'm going to pretend to use it and look in your eyes. Good. Great. Okay, eyes look okay. So now I'm just going to have you use my pretend Snellen chart and we're going to check your visual acuity, okay? So what I'm going to have you do is I'm going to have you cover one eye and read the lowest line possible that's clear for you.
PQLTV.
Good. Another eye?
MRQSZ.
Good, great. Okay, so now I'm just going to check your vision here too, okay? So what I'm going to do is I'm going to have you look straight ahead and I'm going to bring my finger around you and tell me when you see it to check your peripheral vision.
When.
Okay, another side.
When.
Okay, so now I'm going to have you kind of look over my shoulder and I'm going to have you follow my finger, okay? Good, great. Okay, so now I'm going to just check your nasal airways, just checking to make sure they are patent. Great, they are patent, no swelling, no drainage, and I see no redness. Next, I will have you just kind of close your eyes and take a sniff of something for me, and just tell me what it is that you're smelling.
Alcohol swab.
Good, great, thank you. Okay, next I'm going to check your mouth. So I'd use my tongue depressor and my light just to check. I'll do just stick your tongue out and say ah. Good. Your oral mucosa looks pink and moist. And then I would use my tongue depressor to stimulate your gag reflex. Good. Good gag reflex. Okay. So now I'm going to use my pretend tuning fork to, or first I'm going to check your ears. I'm sorry. Just going to kind of look for any kind of swelling, drainage, and make sure that you have no infection. So I see no swelling, there's no drainage, tympanic membrane looks pearly and gray. Go to the other side. Again, no swelling, no drainage, tympanic membrane looks pearly gray. Okay, so I'm going to use my pretend tuning fork here and I'm going to test your hearing, okay? So first I'm just going to have it sit on the top of your head and just tell me if you can hear it.
Yep.
Okay, and then same thing on the side, just tell me when you start to hear it.
Yep.
Okay, I'm going to the other side.
Yep.
Okay, good, great. Next, I'm gonna whisper something in your ear and then just repeat the word that I'm saying.
Plant.
Good. I'm gonna go to the other side.
Plant.
Good, great, okay. Excellent. Okay, so moving down, I am going to take a listen to your heart, okay? So just breathe normal for me. Okay, I'm gonna turn my stethoscope around. I'm gonna listen to one more time. Good. Okay. So next I'm just gonna feel for your pulses. I'm gonna check your carotid. Good. I'm gonna listen too, okay? Good. Excellent. Okay. And then checking your brachial pulses. Good. Radial pulses. And femoral pulses. Check your popliteal. Posterior tibial. And then your dorsalis pedis. Good strong pulses. Then I just stick your hands out for me and check for cap refill. Less than 2. In your toes. Less than 2. Good. Okay, so moving on. I'm gonna move into listening to your breath sounds. Okay? So I'm gonna have you take a deep breath for me. Deep breath. Good. Deep breath. Deep breath. Deep breath. Good. Deep breath. And deep breath. Excellent. Now you lean forward to your back. Deep breath. Deep breath. Again. 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 And last one. Great. So I'm going to have you sit on back and I'm going to have you, I'm going to listen again, but every time that I put my stethoscope to your chest, I'm going to have you say 99.
99. 99. 99. 99.
Good. And then your back.
99.
Good.
99. 99. 99. 99. 99.
Good. Okay. I'm going to have you say one more time.
99.
Good. Okay, great. I'm going to check your pulse ox. Okay. 100%. Heart rate is 77. That's perfect. Okay, great. So moving on, I'm going to move into your abdomen now. Okay, so I'm going to lean on right back for me. Get nice and cozy. Great. Just going to listen first. Normal active bowel sounds. So I'm going to palpate here first, or press here first. Good. Good. And then I'm just going to press. Any discomfort?
Mm-mm.
Good. And then some deep palpation. Just feeling for that liver. Good. Okay, I'm going to have you lean on up for me real quick. I'm just going to check for any tenderness in the back.
No.
Any pain when I press?
Mm-mm.
Good. Okay, go ahead and sit on back. So now abdomen looks great, so I'm going to move into musculoskeletal, okay? So just kind of looking at you, your shoulders look nice and symmetrical. I'm gonna have you give me a good shrug. Good. Now with your head, I'm gonna have you look up and then look down, and then side to side. Good. Arms up for me, and then I'm going to have you turn and then back over. I'm gonna have you point your fingers up towards the sky and then down towards the floor. Good. Back up. Now I'm gonna have you bring those arms back up for me, and then I'm gonna have you pull against me. Sorry, and then push. Good. Now put your hands back out for me, and have you squeeze my fingers, and then I'm gonna pull. Don't let me pull you away. Great. Okay. Then put your hands down. I'm gonna have you swing your legs right around the edge here, and I'm gonna have you stick one leg at a time out straight for me. Great. Now the other one. Good.
Why, thanks.
And then I'm gonna have you stick those legs right back out for me at the same time. Toes up towards the ceiling, and then down towards the floor. Good. I'm gonna have you pull against me. Pull, and then push. Good. And then same thing, pull against me, and now push. Good. Great. Okay. So I'm gonna have you stand on up. And then while I have you standing, I'm gonna have you lean your back as far as you can. Good. And then forward. Good. Good. And then I'm gonna have you do some twists for me. That feels okay. And then side to side. Good. Good movement. So I'm gonna have you go ahead and over here, and I'm gonna have you take some steps for me, right up straight. A nice steady gait. Good. Turn around. Go ahead and walk back. Good. Now I'm gonna have you turn around, and I'm gonna have you walk heel to toe. Good. Great. Okay. You can go ahead and walk on back. Good. All right. Go ahead and turn around. I'm gonna have you take some steps on the tippy toes for me. Good. Great. All right. Go ahead and turn back around. You can walk back normal. And then one more time, I'm gonna have you walk, but I'm gonna have you walk on your heels. Great. Okay. You can come on back to the side here. Before you sit, I'm just gonna have you check. Just kind of do a little motion like this for me, just so I can check your hip abductors and abduction. Good. That feels okay?
Mm-hmm.
No pain at all?
No.
Good. I need to take a seat. Okay. So next I'm just going to kind of check your neurological status and sensory, okay?
Mm-hmm.
So first and foremost, what I'm going to have you do, I'm going to have you close your eyes, and I'm going to use an object, and you're going to tell me if it's soft, dull, or sharp, okay?
Soft. Sharp.
Good.
Soft. Sharp.
Good. Great. Okay. Next, I'm going to have you keep your eyes closed for me, and I'm going to place an object in your hand, and you tell me what it is.
Pencil.
Good. Another object?
Paperclip.
Excellent. Okay, you can open your eyes. Good. Okay, so now I'm going to have you close your eyes for me and squint really, really hard. Good. Now I'm going to have you clench your jaw. Good. And I'm going to have you stick your tongue out and say ah.
Ah.
Now when I have your mouth open, I'm going to have you move your tongue up and down and side to side. Good. Great. Okay. Good job. So now I am going to just kind of do a little test here with you. I just want you to read this paper and follow the directions.
Take this paper, fold it in half, and set it on the floor.
Good. Great. Okay. And can you tell me where you are right now?
In the hospital.
Good. Do you know what today's date is?
10/7/2021.
Good. Great. Do you know what time of day it is?
Evening.
Okay.
Tonight.
Tonight. Good.
After dinner.
Okay. Good. Thank you.
Yes.
In fact, it is after dinner.
Okay.
Good. Okay. So, can you tell me what you did for your birthday this year?
Went out to dinner with my family.
That sounds nice.
Hiked a mountain.
Awesome.
Yeah.
Good for you. It's very good to stay active.
Yeah.
And then, so I'm going to kind of test you a little bit. I'm going to have you count from 100 by sevens backwards as best you can to your ability.
100. 93. 82. 4.
It's
I
okay.
can't, sorry.
It's tough. It's a tough one.
86,
Okay.
and then 79, 72, 60 something.
Okay.
That's all I got.
Good job. That's good enough.
Okay.
All right, so now I'm going to give you 4 words, okay? And I just want you to remember these 4 words. So I'm going to say marker, eraser, pen, and paperclip. Okay? Now I'm going to count from 20 backwards down to 1.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Marker, eraser, pencil, paperclip.
Good. Yes,
Yeah.
that was it.
Okay.
Good job.
Thanks.
Okay, so that about concludes it for our today. You were an awesome patient. Thank you for your assistance.
Thank you, nurse.
And have a great rest of your night.
Thank you, too.
Thank you.